Hi guys, today I want to talk about side hustles in nursing. And I want to talk about it because many people ask about how have you stayed in nursing for so long and how have you stayed in it and still love it. We all know that nursing is not easy and there are times when you become really burnt out. And how I've managed to stay in nursing and not hate it is by having alternatives. So instead of just having the one job, I've put myself in a situation where I have other jobs on the side within nursing. So, for example, at the moment, my full time job is as a nurse educator. So I work in clinical professional development, and what that means is I'm involved in developing education or content for nurses who are qualified nurses to enhance their practice. I'm also involved in, nursing competency. So I work in a team where specifically for critical care, I'm looking at what competencies does a critical care nurse need to have. So that involves looking at what does the Joint Commission expect when they come on to an ICU? What do they expect a nurse in there to be able to do if there's someone with a stroke or if someone has a stroke? What do they expect a critical care nurse to be able to do if somebody codes, etc. I also work collaboratively with other professions. For example, if there was a change in the way insulin is given, for example, and they are wanting to roll out those changes within the hospital, my job would be to assist in how are we going to relay this information to the nurses so that they know what the change is and how it is going to be implemented, how they're going to do things differently because of that change. So I suppose I would say part of my job is being a change agent. So that's my full-time job. And if you wanted to get into something like that, I would recommend that you have a little bit of experience. Maybe I'd say it helps to have maybe 5 years experience at the minimum, because that's the point at which you really start to know what you're doing as a nurse, in my opinion. And also just based on the people I work with, many of them are nurses with more than 10 years experience, but we do have nurses with about 5 years experience and they're doing really well within the team. So that's my full-time job. But I also have another job where I go and still work in the ICU that keeps my skills and my knowledge in critical care fresh. And so I don't feel that pressure of being in the ICU all the time. I'm there, and when I'm there because I want to be there and I enjoy it. And it's something I can dip in and out of as I please. So I would recommend that have more than one job, in my opinion, because then you're not tied to the one job. You don't feel that pressure of, if I'm not there, then I'm not earning. You can be earning from two places, and you can take away that pressure from yourself and the burnout that you can feel from going to the same place, let's say for 36 to 48 hours a week. I think sometimes that is what makes nurses feel burnt out and frustrated with the work that they're doing. The other thing that you can do on the side as a nurse is work for an infusion company. So there's companies out there that will employ nurses on a 1099 basis. And what that means is you're sort of an independent contractor. So you present your nursing qualifications to them and you declare that you are good at starting IVs and monitoring patients. And then you should also have insurance, professional liability insurance to cover yourself if anything was to go wrong. So basically, you're going into patients' homes to give them infusions. It might be something like immunoglobulin. It might be that someone that needs to have antibiotics at home. So you'd start the IV if the patient doesn't have long-term access like a PIC. You would start an IV. You would check the order for whatever medication it is you're going to give. You would do an assessment, make sure that the patient is well enough to receive that medication, document the vitals, and then you would also monitor the patient while the infusion is running, and then monitor the patient after the infusion is finished, and document what you did, how the patient was before you left. Those jobs pay quite well. Sometimes if it's an urgent job where they want someone to go out sort of immediately, you're looking at several $100s to go and complete that job. And it might be somewhere that's not very far from where you live. So you can make a good bit of quick cash by doing jobs like that. The other interesting things that you can do as a nurse, which are not at the bedside, but would earn you a nice bit of extra cash without necessarily being in the hospital, is working in a med spa. So some med spas will train you in what they want you to do. So, for example, there are med spas that will advertise a job and say that they want a nurse or a nurse practitioner, and they will provide full training. So this is where you're being trained to give things like Botox and fillers. And they're going to train you from start to finish before they unleash you onto the patients. And this is quite interesting because it's not necessarily the same as looking after somebody who's not well, like you would in the hospital. These are healthy people who are just doing things to enhance their looks, to make themselves feel better. And within med spas, there are also other things that you can learn to do, like skin treatments and also giving those IV infusions. And incidentally, Texas is changing the law to where only licensed people will be able to give those sort of vitamin infusions, or the infusions that people go and get just to give themselves a boost. Because recently a woman died after she went to a med spa. She was given an IV infusion, and the infusion was given by a person that was not actually a licensed nurse. So that's going to be changing in Texas. It will only be licensed nurses who are able to give those infusions. And I think that's a wonderful thing. I don't see how somebody who is not a nurse can administer medication safely. The other thing you can do as a nurse, let's say maybe you don't want to go to NP school, but you want to go and do something different. You want to go and do something that is not at the bedside. You want to earn a bit of extra money in addition to your regular job. You can go and work for, let's say, a legal company as a nurse legal consultant. So in most cases, you would have to go and be certified, do a course to become a nurse legal consultant. And these courses don't cost a lot of money. They typically cost less than $5,000, which when you look at the cost of going to NP school, for example, or the cost of doing a master's, you're going to end up paying a lot more money than somebody who's going to NP school or somebody who is doing a master's. So you can go and do a small course like that in nurse legal consulting, and then you help attorneys with reviewing charts, medical charts, and sort of explaining to them how things actually work on the unit or in the hospital with a patient so that they can form their case. Other things that nurses can go and do without spending too much money by going back to NP school is things like utilization review. So these are nurses who typically work either for a hospital or for an insurance company, and they're looking at what treatments patients received and whether those were appropriate treatments, to help the insurance companies with sort of reimbursement for services that the patient or treatment that the patient received. So these jobs will typically want people with a little bit of experience, and they may require you, if it's a specialty that they want, they may say, we want a nurse with this specific experience like OB, or they might want a nurse with specifically pediatric experience, or whatever it might be, or it might just be general. Another job that I've done personally that wasn't necessarily hospital based was case management. So I know there are case managers who work in the hospital, but there are also case managers that work outside of the hospital. So basically coordinating care services for the patient. And these jobs are usually done either by a staff nurse or by a social worker. And if you're a person that enjoys interacting with people, getting to know them, if you're good at talking to people, getting information from them, and assessing their needs, and then coordinating services to meet their needs. So When I did it, I worked for a hospice as a nurse care case manager. And typically, what I was doing was visiting the patients within their homes. These were hospice patients, so visiting them and their families. The first assumption when you hear hospice is that everybody's about to die. That's not necessarily true. Some people on hospice still maybe have a few months to live, so they still need quite a few services while they're still alive to ensure that their life at home without going into the hospital is flowing as well as it can. So you're assessing their health needs and taking a holistic view of what their needs are, and then looking at where can I help them get this, where can I help them get that. But you're not working in isolation, you're working with other people. You're going to be working with the hospice physician, you're going to be working with the social worker, you're going to be working with the chaplain, and then you're also working with your management to see how you can meet those needs. So you meet with your team regularly and discuss the patients and see how you can collectively support those patients on hospice. And that is actually quite a fulfilling job. I found that job really fulfilling, but also really stressful, because many hospices, unfortunately, really struggle to retain staff because they want to serve a really large area geographically. And so staff end up finding themselves traveling really long distances between patients. And that is probably why many nurses leave their hospice jobs. So that's something to be aware of. If you're thinking of going into hospice, it's probably, in my opinion, one of the most rewarding jobs that you could ever do. But on a logistic level, it can also be extremely frustrating when you look at the amount of traveling that you have to do between your patients. So if that was something you could avoid, I highly recommend that as a job. So I actually think when you're looking at case management in the UK, that would be very similar to what health visiting was, because I also did health visiting in the UK. And I think the frustrations were similar, because there were times where you were traveling within a borough to go and see patients, but in the morning you're on one end of the borough, in the afternoon you're on the other end. Sometimes that's avoidable if you plan your day in a way that allows you to stay on in one location. But emergencies do happen. Sometimes you have to go in and do an emergency assessment because there's been a concern raised about a child, and you need to go and see what's going on, lay eyes on that child, and rule out any excessive risk to the child. So that was a stressful part of the job, but getting to know families, building relationships with them, making a difference in a child and family's life is very fulfilling. So I would recommend that. Case management versus health visiting, very similar. Those, I think, are very similar jobs, just called different things in the UK and the US. Other things that I think you could do as a nurse as a side hustle. So other roles that you can do as a nurse as a side hustle is telehealth. You could do telehealth for various companies like hospices, home health companies, insurance companies, or even just telehealth companies. So you would be speaking with patients on the phone, asking them questions, so assessing them over the phone, figuring out if it's a problem that you could solve by recommending that they take a medication that they already have at home that's already been ordered, or recommending to whoever employs you that they send out someone to go and see the patient and give them a treatment at home. Or maybe you're recommending that the patient actually go to the hospital and get seen there. You could also do tutoring. So if you're a nurse with a BSN and above, you could do NCLEX tutoring. So many students are looking for tutors to prepare them for the NCLEX. And this is something you could do remotely. And I know a few people who make good money by being NCLEX tutors. Some of them are BSN, some of them are NPs. NPs typically will be tutoring maybe nurses who are studying to be nurse practitioners. So nurses who are doing an advanced practice degree. So this is someone doing their master's or their doctorate, and maybe they need help with advanced pharmacology or advanced pathophysiology. Other jobs that you can do as a side hustle as a nurse is creating content. So there's so many YouTube channels where you find nurses and other healthcare professionals creating content to teach people, whether it's a skill or how to use a certain type of equipment that is commonly used by nurses, or even just prepping nurses for some kind of certification or their NCLEX. So another remote job that you can do as a nurse, either as a full-time job or as a side hustle, is clinical documentation specialist. So this is where you're checking medical records for detail and accuracy so that they meet reimbursement specifications. So when insurance companies are looking at reimbursement for services rendered by a provider or hospital, the documentation has to reflect the care that was given. It has to reflect certain expected standards in order for reimbursement to be given. So I don't think you would need to go and do an extra course to be able to apply for a job like this. If you're able to demonstrate that you're capable of learning this type of work and that you already have transferable skills from your job, you can get a job like that without going back to school to do an additional course. So what I'm trying to say is, when you start to feel frustrated in your job as a nurse, instead of quitting nursing altogether, think about how you can move into a different type of role where you use different skills, where you can transfer your skills that you have from, if it's your bedside job or whatever it is you were doing, transfer your skills, show that you're adaptable, go and do something else. Let your nursing degree or diploma work for you. Nursing, in my opinion, is the gift that keeps on giving. If you didn't want to, you would never have to go and do a master's or a doctorate in nursing. You could keep moving and doing different things that are completely different to just being a hospital nurse or a bedside nurse without spending any more money to go and do those things. So let your degree work for you. That's what I say. Let your nursing degree work for you. You put a lot of work. You know, they say a BSN is the most difficult degree to achieve. So there's a reason why that is. Nurses will do anything. There's very little limit in terms of what's expected of you as a nurse. Many of you will agree that on any given day, you'll find yourself doing something as a nurse that you never ever thought was part of your job description. Sometimes your job description will say, and any other responsibilities that may be deemed necessary for your job to be completed. I've found myself doing things that I thought should be done by an IT professional as part of my job. And I'm okay with it because I'm learning something different. I'm learning how to fix equipment that is needed by nurses to be able to complete their training or whatever it is. And if I can complete it just by using logic and following some instructions, I'm okay with that. I'm fine with that. All I need is to get the job done and get paid. Getting paid is the bottom line. So look for other things that you can do other than that job that's starting to make you feel frustrated with nursing. And I would say try to have a side hustle, try to have a second job, something not as another full-time job, but maybe as a PRN position or as a part-time position, something you can escape to, something that gives you options so that if you ever felt like, actually, I've had enough of this full-time job and I just want to pivot into something else, you're going to be in a position where you can do that without worrying about whether you can pay your bills or not. So I'm curious, if you found this useful, if you found this helpful, drop a comment below and subscribe. I would love to keep sharing my experiences with you. And I'd love to hear what other people are doing in terms of side hustles, what other people are doing in terms of having something different to what everybody is used to. I haven't covered everything. I've just covered a few that have come to my mind, but I know that there's so many more out there. In my next video, I'm going to talk about preparing to get your first job when you come out of nursing school. How do you write your resume? How do you prepare for that interview? How do you get your foot in the door? Because I know that a lot of nursing students often wonder, how do I get a job when they all say they want experience? And not everybody is able to get onto a graduate program or a residency. So some people will be wanting to get a job as a graduate nurse, but not able to get one on a graduate program or in a residency. So I'm going to talk about some of the things that you can do to get yourself that first nursing job and to get the job that you desire, as opposed to just getting any job. So I'll see you in the next video. Don't forget to comment and subscribe. Thank you for watching.